With a population over 600,000, health disparities within the African American community in Baltimore have reached an alarming rate stemming from cardiovascular disease, cancer, diabetes, and now homicides, which rank 5th in the city. Joining us today is Dr. Thomas LaVeist, professor at Johns Hopkins Bloomberg School of Public Health and founding director of the Hopkins Center for Health Disparities Solutions. We want to welcome you. Thanks so much, Doctor, for being with us.
Thanks for having me.
So explain why we're seeing such disparities now and why race and ethnicity play such a role.
Yeah, it's a very complicated issue. There are many factors that produce these health disparities, including broader inequalities in society, which have implications for health, also health behavior. There's also economic factors that play into it.
Okay. Is it true that African Americans these days are living sicker and dying younger than ever before?
Well, not than ever before. Certainly there have been dramatic improvements in health for African Americans over the centuries, but in terms of the disparity between African Americans and other populations in the country, we still do see these gaps.
So why do you think it's so important to explore these health disparities deeper and also in the integrated communities?
So in this country, we've seen dramatic increase in life expectancy, for example. So at the turn of the 20th century, life expectancy was just around 40 years old. Now it's in excess of 70 years old. So there's been a dramatic success for the nation in general, for all ethnic and racial groups. But what we haven't really seen is much increase or improvement in the disparity between the groups. So the question is, while we're able to increase the length and quality of life overall for the U.S. population, why are we not able to close those gaps? And so that's where we focus now, on how do we close the gaps.
And I guess the other question is what the economic burden is in terms of these health disparities for everyone.
Right. So, I think that's an important question. We did a study a few years ago where we tried to estimate the economic impact of racial and ethnic disparities. In other words, what does it cost the U.S. economy to maintain these disparities? And we estimated that cost at $1.24 trillion over 4 years.
Wow.
Now, that's a lot of money. That's about the size of the economy of India, the 11th largest economy in the world. So it may cost a lot of money to eliminate the disparities, but it also costs a lot to our economy to maintain those disparities.
And why do you think it's so important to have a level of trust when it comes to addressing these health concerns?
Well, in terms of the health care system, I mean, you're never more vulnerable than when you're a patient in the healthcare setting, and you're very dependent on that healthcare system to provide the quality of care and to operate with your best interests at heart. So that trust, your willingness to follow the advice that you're given by your healthcare professionals, it all hinges on trust. Most people who receive a prescription never get that prescription filled. There are many reasons for that, but certainly a lack of trust, not certain whether or not this healthcare provider really has their best interest and whether or not that medication is going to help them. These are the reasons why some of these disparities have been persistent.
Why is this an issue that you're personally so passionate about?
Oh, right. I need a minute to think about that one. I didn't get through all the questions.
That's okay. It's obviously something that you've dedicated your life
absolutely.
to, and
so
clearly something you care very deeply about.
Absolutely. So back when I was in graduate school, I was working on a degree in political sociology, of all things, and at the library I found a report and came across this report that showed these dramatic disparities. At the time, it was about a 6-year gap in life expectancy between black and white Americans. And I became fascinated by this question. Why would the color of your skin lead to 6 fewer years of life? And I became just interested in trying to figure out what were these disparities about and how do we fix them.
So in a nutshell, how do you think we fix them? Obviously, it's very complicated, but we have made some strides.
Sure, we have made some strides. It is very complicated, and I don't have a single, sort of one silver bullet answer to that question. It takes many different strategies and many different levels of society. Ultimately, what it comes down to is that we do have race in this country. It's a concept that has we have race in this country. We have a concept that has a great deal of meaning within our society and within our culture. But the issue is, what do we make of race? What's the importance of it, and how do we use race? if we use race as a way of producing inequalities, which is what we have done as a society, then we're going to find inequalities in health. If race is no longer a reason to have people have different experiences in our society, then I think that the disparities will disappear.
A fascinating and very important topic. We appreciate your contributions to it, and thanks for being here.